Welcome to our virtual event, Lessons Learned from the Sky Lakes Medical Center Ransomware Attack of 2020. My name is Dr. Margaret Banyan. I'm a senior fellow at the Center for Public Service at Portland State University. This webinar is being recorded. Audience members are muted and your video has been disabled. If you have questions for the panelists, we're asking then you to put the questions in the chat box. We also ask that the chat be kept respectful. We have a staff member that's monitoring the chat and saving questions for the Q&A following the panel discussion. So with today, I want to start with a land acknowledgement. The Hatfield School of Government is the academic home of the Institute of Tribal Government. And that is working in partnership with our sovereign tribal nations. We know that our panelists today and attendees are participating from many different locations, and I offer this land acknowledgement from Portland State University. What we now call Portland, Oregon and Multnomah County are the traditional lands of the Multnomah, Cathlamet, Clackamas, Cowlitz bands of Chinook, Tualatin, Kalapuya, Malala, and many other family bands and tribes who made and continue to make their homes along the Willamette and Columbia rivers. Today, people from these bands have become part of the Confederated Tribes of the Grand Ronde, the Confederated Tribes of Siletz Indians, as well as the Chinook Nation and Cowlitz Nation in Washington State. It's important to acknowledge the ancestors of this place and to recognize that we are here because of the sacrifices forced upon them. In acknowledging these communities, we honor their legacy, their lives, and their descendants. A little bit about the Marco Hatfield Center for Cybersecurity. This is a collaborative partnership between computer sciences and engineering, public affairs and public policy, and business administration. It's designated as a National Center of Academic Excellence in Cyber Research by the National Security Agency and the Department of Homeland Security. The Marco Hatfield Center for Cybersecurity strives to make important contributions to regional and national efforts to further cybersecurity expertise and education in ways that complement and enhance national goals and investments. Later in the event, I'll share information with you about our upcoming professional certificate in building cyber resilience. The 12-week non-credit professional certificate is designed to help you gain foundational knowledge in cybersecurity so that you can develop policies and strategies to monitor or manage your cyber risk. We'll be sharing more information about the program in the chat shortly. Today, as I mentioned before, we'll be using the Q&A feature in Zoom to allow you to ask questions during the event and for our panelists to answer your questions live. We'll also allow you to vote on the questions you most want answered, so they'll rise to the top of the priority. This webinar is being sponsored and made available to our attendees free of charge, thanks to the support from Palo Alto Networks. They're also giving away a few door prizes to say thanks for joining us in this webinar. And to enter to win one of their swag bags, which is a multi-charger, Yeti cup, Nike hat, and more, please follow the link that we're posting in the chat thread. And by volunteering your contact information, they'll contact you if you win. So it is now my pleasure to introduce Ron Buchanan. Ron is the Chief Information Security Officer for the St. Charles Health System in Bend, Oregon. Prior, he was the CISO for the state of Washington and Chief Information Risk Officer and Director, Information Security and Privacy Office for Oregon's Department of Human Services and the Oregon Health Authority. Ron has been a consultant for the Federal Bureau of Investigation's Criminal Justice Information Services Division and served as a civilian supervisory special agent with the Air Force Office of Special Investigations, focused on cybercrime and counterintelligence investigations and operations in the US, Europe, and Asia. So I will now turn it over to Ron. Thank you.
Thank you, Dr. Banyan. When Oregon Sky Lakes Medical Center discovered several of their computer systems were encrypted by ransomware in October of 2020, they took immediate action to prevent further damage. State and local institutions are increasingly targeted by cyber attacks as criminals study such incidents and seek to replicate them. To share the lessons learned from this attack, the Mark O. Hatfield Center for Cybersecurity is hosting this virtual discussion on what mitigated the impact of the attack. Oregon's community can come together in this space to prepare for future attacks, especially during a pandemic when patients' lives are already vulnerable. Joining us today as a panelist is Art Ehuan. He's Vice President for the Crypsis Group, Palo Alto Networks company. Art joined Crypsis after running the global cyber risk services practice at the global professional services firm Alvarez & Marsal. Art has worked with governments and law enforcement in the US and overseas on cybersecurity cases, frequently giving expert testimony in federal, military, and state courts on digital forensics and cybercrime matters. For nearly 2 decades, he has served as a lecturer for the US State Department's Anti-Terrorism Assistance Cyber Training Program, while also working as a supervisory special agent with the Federal Bureau of Investigation and a special agent for the US Air Force Office of Special Investigations. Art has been retained as a cyber expert on prominent data breaches to include Sony Pictures, Target, Anthem, Equifax, Marriott, and Capital One. Thanks for joining us today, Art. And the reason we're all here today, it is my pleasure to introduce John Gaede, the Director of Information Services at Sky Lakes Medical Center, a nonprofit community hospital in South Central Oregon. John has 20 years of professional information technology leadership in healthcare, with 9 years of clinical experience as a clinical laboratory scientist. So without further ado, I'll hand the floor over to you, John.
Thank you very much. Thank you for the opportunity today to kind of share our story. I'm going to share my slide here, so let's make sure that's working. Here we go. Are we good, Ron, on the slide?
Yes.
Very good, thank you. All right, let's jump right in. So again, thank you for the opportunity to tell and explain what happened at Sky Lakes Medical Center. So just a little bit of a background, and then we'll describe what happened and some of the impacts of what happened. So Sky Lakes Medical Center is as mentioned, a standalone not-for-profit community hospital. Of the 6,000 or so hospitals across the country, just about half of those would be under what we call 200 bed and below, and represent rural medicine throughout the country. And I want to start with this point because in many respects, standalone community hospitals, not-for-profit community hospitals, take care of an isolated region or geography. So in the slide you can see in front of you, Sky Lakes Medical Center is located in South Central Oregon, and you have to drive about 140 miles to the north to get up to St. Charles Health System, or about 100 miles to the east to get to a community hospital with East Lake District, or about 100 miles south to get to Modoc Medical Center in Northern California, or 72 miles east to get to Asante Health System. Typical in the industry, these standalone community hospitals have very tight margins. So on a good year, we have about a 3% margin. And that 3% goes to recruiting physicians, putting in IT equipment, replacing carpet, or buying a new CT scanner. So when we enter this world of cybercrime and extortion against medical centers that are standalone, not-for-profit, there for the community to deliver care, the highest quality care possible to our patients, this becomes very, very problematic in this world of cybercrime. So let me tell the story of what happened at Sky Lakes Medical Center. Sky Lakes Medical Center was hit with ransomware Monday, October 26th of 2020. So just imagine with me, if you would, sleeping away at 3:30 in the morning, getting a good night's rest, and all of a sudden the phone call rings, and the first word you hear, "We've been hit with ransomware." That happened to me on the 27th that morning. I got that message, "We've been hit with ransomware." Many things started racing through my mind, but one of the first is, oh no, I've got to tell my boss. You see, my 20 years in healthcare, I'm competitive by nature, and I had a former CIO at UC San Diego Health System, and when I was there for a short time, Ed Babakanian said to me, "John, it's not a matter of if, but when." And I had been working in healthcare. We'd never experienced any difficulty around cybersecurity, never felt like that we were necessarily a vulnerable target. But guess what? We are. The world has changed. So at 1:30 a.m., to give you a little bit of a background, what happened, at 1:30 a.m. on Tuesday morning, October 26th, Information Services received a phone call from a nurse in the hospital saying, "Hey, our computers are very, very slow." So our team, the on-call person at 1:30 in the morning, being called out of bed, kind of getting past that groggy state, trying to figure out what's going on, they began to research and figure out what was going on. He ended up calling his manager, his boss. They worked on the system for a while, and that's when I received the call at 1:30 a.m. Let me talk to you about what happened. So we learned from Cisco Talos, who was a consulting group that Skylakes hired to help assist with the process. They gave us a timeline and did their forensic studies. And what you see in front of you here is that timeline. So at 8 minutes past noon, at 12:08 Pacific time, just after lunch, an employee received an email, and that email offered a bonus. That employee earlier in that day had met with human resources, came back to her desk, she sat down, she opens this email and she sees bonus. She clicks on it. And what she experienced was this. She clicks on that link and her computer froze. She couldn't use her mouse. She thought, wow, that's strange. Once she was able to regain recovery of her mouse, she went ahead and closed the window, and she thought, that just doesn't feel right. But she didn't say anything to anybody or report that. Well, now you can see on the timeline kind of how the process went. So within about 30 minutes later, there was a malicious file that was dropped onto the computer, and there was a 0-day, it's called the 0-day site. It's where the bad actors stand up a malicious site for that purpose, for that day, dropped a payload onto the computer, and about 50 minutes later, the first PowerShell command, Cobalt Strike, tools that the bad actors use to do their work, was executed. And then you can see about almost 11 p.m. that night on Monday, October 26th at 10:50 p.m., we had the first execution of the ransomware binary, Ryuk, that started encrypting systems at Skylakes Medical Center. Here's an example for you to see what that email looked like. So this is the attack vector, that phishing email that came into our organization and offered a bonus. And you can see numerous links here. Each of these in blue with an underline is a link to a Google document. The employee clicked on the link, and let me show you what those links look like. So these are the URLs for each of those links in that email. Just looking at the URLs, you don't see anything in here that says ransomware or bad actors from a bad state. They're just Google Docs. They're normal standard links that any of us would use for Google Documents, and many of us use Google Documents. But she clicked on the email. All of these links took her to that 0-day malicious site and then dropped a payload on her desktop. This is what the files look like on the desktop once they're clicked. I'm sorry for the fuzziness of this, but this is a screen capture from one of our servers at the organization. But if you notice towards the end of that file name, you can see the .ryk. That's the Ryuk ransomware. And that's what our team discovered after being called at 1:30 a.m. You see, Skylakes, we were at the point of a perfect storm. And we were also at the tip of a spear in this whole thing. So the Department of Homeland Security, Health and Human Services, the FBI, they had a scheduled webinar that they're doing with Chime to alert healthcare that they had notice of a threat coming to healthcare. They were estimating about 400 healthcare organizations were going to be hit. Unfortunately, Sky Lakes Medical Center was at the tip of that spear. The University of Vermont Health Network, St. Lawrence Health System of New York, and Sky Lakes Medical Center on the West Coast, we were all hit at approximately the same time. I know I spoke personally to St. Lawrence Health System. Their employee clicked on the system at 3 p.m. Eastern time. That would be noon Pacific time. Our employee clicked on this email at 12:08, 8 minutes after noon, when we were hit with the Ryuk ransomware. Unfortunately for us, this notice came out from the FBI 3 days after our attack. So the initial challenges that we were facing, like I said, was a perfect storm because we had a couple things happening within the organization. First of all, we had just moved and upgraded our infrastructure in the last year to a new platform, and that platform was experiencing some slowness already. So that began to build in that delay of response. Initially, we were troubleshooting a ticket that we had in with our vendor to look at what was happening on our infrastructure. So we assumed when we got that call that the slowness was due to that. Secondly, we were just in the process of upgrading all of our devices, servers, and computers in the hospital with protection. It's a product called Cisco AMP for endpoints, and that sits on all of these devices to, if it sees malicious software like this, it's to contain it and pull that system offline. Secondly, because it was new and we're in the process of implementing it, we did not have it configured yet to stop the threat. So it set Sky Lakes up for a perfect storm and for the ability of the malware, once it was inside of our organization, to start propagating across our organization. Let me talk about a few of the initial challenges on top of the perfect storm. And that was, we had to figure out what was our cybersecurity policy and who could we bring in. We realized this was much bigger than what our team, none of us had experienced this before. So we actually took us 2 days. We worked with our cyber insurance carrier and they recommended Kivu Consulting to come in and help do cleanup. But I knew that our organization, we needed to know the who, what, how, when, why. I knew our executive suite, they're going to want to know those things. So we also hired Cisco Talos to help us determine root cause and do forensics analysis so we could get at the source of what happened at Sky Lakes. Now I want to kind of walk you through the steps that Sky Lakes took immediately when we discovered that this was in fact ransomware. The first strategy was to shut systems off. So we wanted to protect against any further infections. We wanted to try to protect against the movement through the organization, not knowing how much of our systems were compromised. And initially, I'm going to be transparent with you guys, and so that we can get this information out there. Our team initially, in the early hours after I was called at 3:30, we started trying to restore systems and bring them back online. I'll give you an example. We use a system in healthcare called Vocera, which is a hands-free system that nurses, physicians can have. They can be hand-free, and they can say, hey, call the nurse in room 202. It'll call them, and it's hands-free. It leaves their hands free to take care of patients and do patient care work. And we wanted to get that system back online so that our nurses and physicians could have communications. Well, as soon as that system came back online, it was shut down. So by 8:15 that morning, we had employees shut off every single computer in the organization. We were shutting down every server in the organization, and we say shut down, power off, unplug from the network, and all third-party systems at our hospital. So one of the example of a third-party system would be, it's called Pyxis, and it does all medication, supplies our medications. All of those systems had to come offline. Secondly, the next step was Sky Lakes is something called a Community Connect. So we use Epic as our electronic medical record. And because of the size of the hospital, being rural hospital, we had to purchase Epic through a larger health system. And so that's Asante Health System. And so we had to call Asante and say, we need you to turn off your systems. We've been compromised by Ryuk ransomware. You can see at the bottom of the slide there, the CIO at Asante, just like I remember the 3:30 a.m. call, remembers that very well. The call at 7:27 a.m. Hey, Dr. Milligan, we've been hit with ransomware. And then the right side of the screen, you can see his text back to me, and it says, John, tell me a name of that virus again, and Ryuk ransomware. And ironically, I had asked him in that initial call, hey, do you have any suggestions for who we could reach out to help us through this? And he mentioned a couple vendors there, one of them being FireEye, which interestingly, only a couple months later, they too would be breached. So the bad guys would, and bad actors would even get on the backside of a huge company like FireEye. So thirdly, the next step we did is to set up a command center. So we went onto the second floor of our non-clinical area of the hospital. We brought our entire team up. We set up our computers, and we lived in that space for quite some time. And we had a couple other meeting rooms set up on that floor. The other thing we did was to have established communications with the C-suite, with our administrators, the vice presidents, as well as the entire organization. So what we did is we started the first 3 days, we ran huddles every 2 hours on the hour to give updates of where we're at and what was going on. And then from there, we went to a morning huddle at 8:15 and a 5 p.m. huddle. Now you got to remember that every system is down. Think about it. No email, no financial systems, no clinical systems, no EMR for the entire hospital. Outpatient, ambulatory, inpatient, the intensive care unit, OR, all through the organization, no systems up. Because of COVID earlier that year, so if you can all remember back to early 2020, in January and February, we started this whole COVID thing in our country. We were scrambling from that, and all of a sudden, like you all, we had to go to virtual meetings. And so we had stood up a product that Cisco has called Webex Teams. Many of you might use Microsoft Teams. This is Cisco's product, Webex Teams. And we had that set up, and we had started these huddles in our organization virtually. So we had that technology in place. That was the only system we had running when we shut everything down. That was running on our cell phones, obviously off of Sprint and Verizon and all those carriers. The only other communication that happened operationally with our directors across the organization were cell phones, texting on cell phones. So that was the base of our communication. And we would meet, and then we'd have these huddles twice a day that we would inform the organization of the status. And then the next step was, how do we prioritize what comes back online? What comes first? So I'm gonna give you an example here. In our mind, we were focused getting our clinical information systems up so we could take care of patients. But this was the end of October going into November. We were gonna have our first storm, and all of a sudden, facilities services saying, hey, wait a second, we need our system brought back online. We can't start heating all of our sidewalks around the building and the snow's gonna come. We need that system. And you can imagine any number of departments coming saying, hey, we need this system for this reason. So we agreed to prioritize our clinical systems, and then we'd make exceptions like for facility services to bring on the system that would allow Johnson Controls, that would allow the power plant, as well as heating the sidewalks around the organizations, given that we're coming into winter. On your screen, just kind of an example of a prioritized list that we worked through and had to create in the moment. So let me walk you kind of through some of the processes we did to recover, and what does that look like? So on the server side, we were advised by Kivu Consulting as well as Cisco Talos. They gave us very clear plans that we're going to have this environment where we're going to have a dirty area with the infected systems. We're going to have an intermediate area, a staging area, where we were going to restore from clean backups and make sure systems are functional. And then we're going to move them into a live environment where they could be tested and then released to end users so that the clinicians could begin to use their clinical systems. This didn't only affect the servers, this was every computer in the hospital. So think about you going, if maybe you're working from home, but remember the days when you worked in the office and you came in and sat down in front of your desktop PC and you had all the things that you like on your PC, all the applications that you use to get your work done. Well, 2,500 computers across the organization were powered off, and we had to replace them or rebuild them. We re-image them. When we do that, that means all the individual ways that the computers are set up are now set back to factory default. So there's a whole lot of work that goes. So we had to replace all these 2,500 computers by re-imaging them or replacing those computers throughout our organization. And we did that over about a month time period. All the third-party systems. So for example, in a hospital, we use a product you can see on the screen called Pyxis. This is a system, again, that runs all the medications. It stores those medications, and as nurses come to get those medications, it tracks that. We know what patient it goes to, when it goes to, it does all that tracking. Those systems are offline. In order for us to bring them back online, we have to do assessments to make sure those systems are not compromised. Diagnostic imaging, as an example, CT, or an MRI, or an X-ray, or an ultrasound, all of those systems, we had to work with bioengineering and work with the vendors to do assessments. Our smart pumps, the IVs, the fluids, and all the patient areas had to be assessed for compromise on the network. And then there's the end users. There's everyone in the organization who's going to log into the system. Every password. Nobody could get back onto the recovered systems until their password is changed. We adopted Asante's policy, which was 13 characters of strong password. And it was not only every end user. So for us, it's probably about 3,000 people between staff at the hospital and those outside. And then also every vendor. So we have about 150 different systems at the hospital. Every one of those vendors, in order for them to reconnect, we had to change all of those passwords. We had to assume every password was compromised. Our focus and passion, as I mentioned, was we need to get our clinical systems back online so we can do patient care. So we can take care of our patients. Remember, our patients would have to drive winter. You have to go over the Cascade Mountain Range to get to Asante to take care of the patients in our community. And one of those key areas, because cancer does not wait, is our medical oncology, radiation oncology systems. So on November 7th, so we went down October 26th, we turned them off. It took us till November 7th to bring those systems back online. We were able to bring the technology online on the 7th, but it took another 2 days to validate the systems, to make sure they work, make sure we have all the patient information correct, and have the clinicians, the physicians and nurses that use these systems make sure that they were accurate and were working correctly. In that process, we had to also notify every vendor and say, hey, you can now connect. We need you to change your password, but we had to send them validation and documentation to say, we've restored your system. It's in a clean environment. It's okay to connect. So we notified them and had that conversation with each of those vendors. So for us, the zero laser focus system to bring back online was our electronic medical record. That's where physicians are tracking patient histories and medications and allergies and all the documentation, whether it's in the emergency department encounter or up in the ICU or in the operating room. So in order for us to connect to Asante, they had never been through this before. Sky Lakes hadn't been through this before. We couldn't find things in the industry on these community connects. So we had to create this memorandum of understanding between the two organizations that now gave Sky Lakes a target to say, here's what you need to have in place in order for you to connect. Make sure it's clean so that we don't infect our systems and the other community connects that we service. So that document had really 4 pillars. One was, it said we had to have a clean bill of health by a third party. Secondly, that we will now share our risk assessments and pen testing. Those are assessments we do annually in IT and healthcare IT to make sure our systems are secure and all those kind of things. We'll share the summaries of that. And then timely notification. If you remember the timeline I shared with you, the document was clicked on at 12:08. The first encryption happened at almost 11 p.m. Monday evening. And Tuesday morning, I was notified about 3:30 and we were shutting things off by 8 a.m. So we had to really know if anything like this happens in the future, within 30 minutes, you're going to be letting us know. We agreed to that. And then finally, a framework for us to do our security culture and postures around the NIST version 2 framework. We had to also come up with a go-live plan. When you're down for 23 days from your electronic medical record and total paper, this was like a go-live. So any of you in the audience who are in healthcare know that when we transition from paper or we go to a new electronic medical record, all the work that happens across your organization. So we had to come up with a go live plan. And this is just an example of that we submitted to Asante. And then here's some of the whiteboarding sessions in the moment that we were doing. In order for us to bring our electronic medical record back online, guess what? There were a whole bunch of other systems that we had to address. So in nursing, the cardiac monitoring, all the equipment that monitors the vital signs, the patient's heart and the EKGs, diagnostic imaging. I already mentioned Pyxis in the pharmacy, laboratory, all the systems, all the instruments that talk to the electronic medical record. We had to have all those independent systems running so they could speak to and talk to the electronic medical record. And then there were some core servers that sit between systems that help that all those systems communicate. So we had to pull all of those together and make sure those were running. So when we went live again on Epic, all those systems were up and running and restored. We went through that whole 3-tier process I mentioned earlier. We had to restore them into a clean environment, restore from good, known, clean backups. Here's an example. One of the key systems at our hospital that hit was our PACS. That's Picture Archive Communication System. That's imaging. So all of the images now are electronic from all the modalities in diagnostic imaging. And that system was completely encrypted down, and it was going to take weeks to months to bring that back online. So we actually engaged the market and brought a system online. We signed a deal on Monday afternoon at 2 o'clock, and we were live by Friday on a brand new PACS system. But this was our whiteboarding system documenting how we're going to bring this online in a very, very short time. This is a picture of our wonderful nurses and doctors at Sky Lakes Medical Center. We had been down for 23 days on full paper for all of our clinical processes. I'm going to talk about those and the impacts here in just a few minutes. But we had to back enter all that data for every patient that was in the bed in the hospital from paper and get that into the electronic medical record. So all of the orders, the lab results, the imaging studies, all of that information would be correct, accurate, and up to date. And this is a picture of our staff doing that. So we ended up being offline, 100% paper. Remember, no email. The only system that we had as an organization that had some of the organization was the Cisco Teams. And then it was the directors having the cell phone numbers and the ability to text their staff. So we were offline 23 days. We went live on our electronic medical record on Wednesday, November 18th at 10:30 that evening. Again, remember, we don't have email at this point. That was probably around closer to 40 days before we had email running in the organization. And then the P drive and the F drive, that's where you keep your personal documents as an employee at the medical center. So that would have your policies, that would have any documents that you need to do your job. We still didn't have access to those systems either. Here's an example of some of the innovation. I want to kind of shift focus now and talk about some of the impact to having your electronic medical record down. So this document that I'm showing you here in the screenshot of this Excel spreadsheet came out of a meeting that we had, one of those stand-up meetings. The director over our intensive care unit says, John, I just got to tell you what life is like here in the ED and taking care of our patients. They're on all these medications, and we have to do everything by hand. We have to write all this by hand. We got to do all of our labels. We got to write everything by hand. So after I heard the angst in her voice and saying, John, we're doing everything we can to take the best care of our patients. And that's what I love about physicians, nurses, people who are in healthcare that are there for our patients and our communities, is they will take care of patients, even with lack of technology. But I learned from that director. I interviewed her this week, and she goes, John, even with COVID, even with the impact of COVID, as we're learning about that disease and we had to create COVID units and the stress that brought to the health system, that was nothing compared to being on paper for 23 days. When you have your electronic medical record, you have your entire history, you have all the allergy information, you know, all the medications, you know, from visits, I have all this information. When you're on paper, you're thinking, what am I missing? And when you have a passion and care and concern for your patients, there's real risk. So we gathered some of our nursing informatics team and said, what can we do to innovate? How do we help Christy? How do we help her unit? How do we do this more efficiently and better now that we're in this downtime? So we took our backup computers that are located in different units, unplugged from the network, but we can put Excel on there. We can connect a printer to it and not infect anything else. So we ran those locally, and they created the ability to create labels in Excel and print out labels. And let me just tell you this, Staples in towns in Klamath Falls, we bought every single label that they had. We went to Walmart and bought labels. We're fortunate we weren't like in a nationwide crisis, because we emptied our community of all the paper products because of our situation being downtime. But the team was able to make a huge impact by now having the ability to print labels off and to keep track of medications electronically. It saved a whole bunch of time from all the handwriting that needed to happen. So here's some specific examples of some clinical impacts. So imagine a patient coming into the emergency department and we don't have their medical record now. In the old days, when we were on paper, we would call medical records or health information management, and we'd say, hey, you know what, can you bring up the chart of Jane Doe? But guess what? We've been on electronic systems now for years and years. And guess what? We no longer have that employee that's their job, because our technology became efficient. That FTE no longer existed. And so trying to get a patient history, and especially if you're working with a patient that may not be able to communicate well or at all, how do we find family members? How do we get access to a phone number? How do we track someone down that we can ask, do you know if this patient's on any medication? So the patient history just became a challenge. I listened to Dr. Niskanen talk to me about how he would, in some cases, have to track down family members to pull information together. Secondly, imagine going to medical school, all your training's electronic. I think about my kids. I mean, right? You hand them a cell phone, and from 3 or 4 or 5 years old, they figure out the technology. But now you got to place an order on paper. When I'm in an EMR, it walks me through. Do you want this to be a daily order? Do you want this to be urgent, a stat order? All of a sudden, I have to do all of this on paper. And for many, that was a challenge, because we had nurses, respiratory therapists, physicians, everything's been electronic, but now to have to do this on paper, and that was a real challenge. And then something as simple as, again, we had worked out processes because of technology and efficiencies we gained, bins in the ED. We now have to track this paper and this order in tubes of blood from here up to, we no longer have our tube system. We draw the blood, that tube system's not running to get that blood up to the laboratory. Guess what? We no longer have the person, the FTE, and the organization to now sneaker those samples up to the laboratory. And then I mentioned communication. We still happen to have what we call whiteboards in our patient rooms. So that's literally just what I have behind me here, a whiteboard. And that became a lifesaver for our organization to be able to communicate. You can imagine if you're designing a new wing of a hospital, it's now 2021, right? We have these incredible technology to do these things, but I would highly recommend that you have a whiteboard in that room that's available for these kind of things. And again, in healthcare, we do this very well. We have downtimes that we experience. It might be a day, maybe 2 days, but when you go 23 days, the game completely changes. And then the communication between the departments, between lab and between diagnostic imaging and nursing, all the communication that has to take place, and we didn't have the tools that we're normally using. So here's a quote that I found fascinating. I interviewed our acting CNO, Chief Nursing Officer right now. His name is Ron Buchanan. He was the director over the ED during the time of this downtime. And look what he says. We have worked downtime out of the process. We have worked downtime out of the process. So we no longer have that bin sitting down in the ED. We know the nursing units no longer have the unit secretaries that used to handle all that paper when a paper order would be placed, getting that up to the laboratory, making sure that the chart is up to date. We no longer had the colored clips to go on charts to notify us when the next step needed to be done. All of those, we've become so efficient on our technology, we didn't have the people or those resources available to us. And let's think a little bit about the financial impacts. So if your organization experienced this, could your organization weather 2 months of no revenue coming into the organization? That's what happened to Sky Lakes. So from October 26th, it took till December 28th before we were able, through our back entry processes, to even drop a bill. On the inpatient side of the hospital, it wasn't until January 25th. So it's months with no revenue coming into the organization. And we're still holding and haven't dropped charges for our emergency department and ambulatory areas. We're probably within about 2 weeks. So we're talking about 5 months to back enter and to recover on these systems. Or think about all the overtime hours spent. Yes, there were the overtime hours related to IT, being here 24/7 to bring systems back online, but multiply that across the organization. Or how about this? On the nursing floors, we all of a sudden had to have our nurses who have been in healthcare for a long time, we had to add staff. We had to have those nurses that lived in a paper world before recreate those downtime processes so we could take the best, most efficient care of our patient. The other impact was we decreased, just like with COVID, we had to decrease our volumes. It had a financial impact to the organization. We had to do the same thing here so that we could maintain and make sure we take care of our sickest patients at the hospital. And then finally, we had to continue to recover all the rest of the systems, about 150 different applications, 600 or so servers to bring back online. And we've just completed those this week to give you kind of a sense of what it takes. So one of the key things that if there are any of you out there that could imagine having a downtime for this long is, like I mentioned, we have good paper processes, but what about when it's 23 days? How do you track all that? So it's your medical record. For us, it was the accounts payable, general ledger. Think about all the invoicing. Think of all the systems. We hadn't received an email for 40 days and we had bills due as an organization. I can't tell you how many emails I got saying, hey, you guys haven't paid this. Well, sorry, we were down for 40 days and the system wasn't available to us and we're just getting it back up. And now we have to do all that catch up. And remember, for Sky Lakes, this is happening right in the middle. October to November is when, on Oregon, every hospital had their spikes and their maximum influx of COVID patients. I want to again mention Christy Wiles, the director, shared with me, John, having to deal with the COVID side was stressful, but having the EMR down was even more stressful. And then there's the potential data loss. So I mentioned earlier, our picture archival communication system had to be replaced, but we had 40 terabytes of data and 1.5 million studies. In the end, because we got that system shut off in time, we were able to recover almost all images except for about 730 images. And trust me, even one image is too much in healthcare not to be able to reproduce. So our physicians and staff and organization were doing the right thing and taking care of our patients there. And then any data that wasn't stored on our backed up drives, if you stored a copy of a document locally on a computer, that was lost. So some of the big takeaways are, gets really, really practical. Prescription pads, when we went down, we had some, backup prescription pads in case we were down for 24 hours, but not 23 days. You're talking physicians across the organization in the emergency department and the operating room. We didn't have enough. We had to go get prescription pads. Or now that we're on all this paper, having enough toner for our copiers or our downtime forms. All of the downtime forms we had, again, they were set for 24, 48-hour downtime, but not 23 days. So as an example, in nursing, they had an intervention that we didn't have a downtime form for. So this paper side and having people understand how to use that paper, how to place an order when it's on paper. So again, we overstaffed. We had some of our nurses that were in that world help coach the younger staff on how to properly document and capture that information so we could take the best care of our patients. And then there's the whole backload of getting all of that information back into the electronic medical record, being able to get that from the paper back into the electronic medical record. So how do we prevent this? What can we do? So first of all, I would like to say that Sky Lakes Medical Center, we have not had to pay a ransom because we had good backups. Every Windows-based system at our hospital was compromised, but we had a backup system, Cohesity, that's on a Linux-based system that was not compromised. We had good backups and we could restore from those backups. I can't imagine being in a place, and I know that this has happened to organizations, where they don't have the ability to back up their data. And again, this is patient lives. Cancer doesn't wait. We had to bring that medical oncology system back online. And we did that because we had good backups. The highest recommendation from Talos and Kivu was to have a security operations center, 24/7, 365 monitoring system that lives on your network and watches for these things and helps stop them in their tracks. And probably the most important point on this slide is educating first our staff. Our staff are the number one, the first line of defense for security. So when that phishing email comes in, looking at it, oh yeah, there's always a sense of urgency. If you kind of hover over that link, you can say, oh, that's not the business. Educating our staff on what to look for and to be aware of. Next, having a playbook. We didn't have a playbook in place. We're now putting that in place. We had downtime processes, downtime policies, but not a playbook. So we're in the process as an organization going through and putting that together for every department, interviewing every director, staff. So we make sure, like in the ED, having that basket available or having that whiteboard available in the nursing department. Paper, making sure that our paper processes are designed, because unfortunately, again, we live in a not if, but when scenario in the world that we live in. And so in the middle of this, we just learned a whole lot about humanity as well. Incredible people coming together to do the right thing for our community and for our patients. Here were the top recommendations from Talos based on the Ryuk ransomware. The highest recommendation was a multi-factor authentication. So many of you use this maybe at your places of business. When you log into a system, it calls back to your phone. So you have another way to validate, hey, it's you logging into the system. Secondly, as I mentioned it earlier, the continuous monitoring of the network. And then I'm going to take you to the bottom two, an incident response plans, playbooks, having those in place. And then finally, the security awareness program. Education is absolutely key because our staff become the front line of defense for the organization. I'll stop there, Ron. Turn it over to you.
Thanks, John. That was vivid, I would have to say. I could feel as I was walking through it with you. A couple of points I took away, I think, that are worth mentioning is it presented initially as an IT incident, right? And then you went through the steps of addressing an IT incident as far as backups, recovery, what have you. And it took some more investigation to realize that it was more than a IT failure or an IT incident, if you will. A second thing is backups. Backups were huge. And so definitely kudos to you guys on that one. A final observation before we get into the Q&A part is any cyber incident for an organization is a shock to the system, or in this case, a shock to the health system. But ransomware, especially, kind of like a natural disaster, puts the system into shock also. All attention is diverted to those essential organs, if you will. And the peripherals, the arms, the legs, what have you, the lines of business, they stop functioning for a while, essentially, as we focus on, in this case, IT being the vital organ, because that's where the information is stored. That's how communications happen, what have you. And so that's the disaster recovery part, is getting those systems back online. And then those peripheral lines of business, the other administrative offices, they're part of the business continuity. And so I thought you did a great job also of explaining how, as disaster recovery is happening, how does the business of healthcare continue via paper, via teamwork, using cell phones and what have you. So that was a fantastic description. I appreciate that. A quick reminder to everybody in the audience that we do have a Q&A function at the bottom of your screen. So please, if you have any questions at all, feel free to drop them in there, and we're going to do our best to get to them. We're going to take a few minutes to talk with Art and John also from a panel perspective as far as getting their feedback and general knowledge on ransomware before we get into the audience questions and answers. So Art, what are your thoughts having heard what John said? Also just maybe some questions, maybe some answers that you have from based on your experience on why is ransomware so prevalent versus other types of cyber incidents or cyber crime, and who's doing it? Because we assume it's probably not kids in mom and dad's basement. It's probably more organized. So your thoughts on that would be appreciated.
Sure, absolutely. And thank you for having me here. And so ransomware, the things that John saw, the activity is very consistent with the activity we see almost every day. So just to give you some numbers, last year we released a data breach and incident response report. And for 2019, the healthcare sector, and that'll involve hospitals, pharmaceutical, healthcare providers, approximately 22% of the victims in over 1,000 matters that we worked in 2019 were healthcare providers. So for our company alone, over 1,000 matter, 22% of them involved the healthcare sector. So pretty extensive. Many reasons. I'd say number one is that the healthcare sector in particular cannot go down, right? It is a sector that has to be up for the most part 24/7. So if you're able to compromise their networks and deploy ransomware, they've got to do something, right? They've got to stay up, and the threat actors know this, right? Another reason, unfortunately, is that the healthcare sector, and I hate to use the word permissive, but it is a sector that unfortunately has a lot of opportunities for these threat actors to act upon. You've got doctors, you've got you've got staff, and you've got volunteers, and now especially with everything that's going on with COVID, that landscape, that perimeter that used to hopefully be somewhat contained, has expanded vastly. And again, it's just providing these different threat actor groups the opportunity for targeting. Of the different groups that are out there, I would say from what we see, most of this is organized crime groups that are specifically attacking this particular sector. And I'll give you an example. We recently worked with a healthcare provider that, and you're not going to believe this, and I still find it hard to believe, that in the space of 6 months, got hit by 3 different threat actor groups with ransomware. So, and what was interesting, it was 3 separate groups, and obviously these groups use their own, special ransomware that they deploy in the infrastructure. But what we were able to see is that they appeared to be talking to each other, even though they were separate groups. And thus, by the time they got to the 3rd attack, they came in and immediately turned off the endpoint detection response tools that were in the environment specifically designed to see this type of activity. So we were surmising that they were, obviously these groups were talking amongst each other, providing information to the next group that was going to hit this particular provider. So it's using the word, pandemic, I would say it's a pandemic that unfortunately is impacting the healthcare sector. The other thing that we're seeing now is, the medical devices, right? The IoT medical devices that are, being brought into healthcare and hospitals that are, running the pumps, running the infrastructure inside of a hospital. Again, these devices, again, open up a lot more of a landscape for these threat actors to attack. And unfortunately, a lot of healthcare providers aren't able to recover in the manner that John's organization. Very fortunate, John, and bravo to you in being able to recover. We see, a lot of times, unfortunately, they're not able to recover because they go in and are able to encrypt the backup systems. In John's case, they weren't able to get to the backup. That's why it's so important. And we recommend having a backup that's different OS than what you're running in your environment, right? So in John's case, he was running a Linux, Unix variant backup system that the ransomware wasn't able to jump over to. Unfortunately, a lot of organizations they're running maybe say a Windows backup system. So when the ransomware is being deployed, it's able to jump over into that environment. And then the other issue is, and John saw this obviously, it isn't as easy as saying, okay, we've got backups. There's still a whole process that has to go into restoring back to operations. And I worked with another healthcare provider that they had backups, a very similar environment to John's, and they unfortunately wound up having to pay because some of the critical systems in the infrastructure they could not recover. So they unfortunately wound up paying several $1 million to get that critical data back. And even then, they still, with the backups that they had, it still took them several weeks to restore back to operations. So it isn't unfortunately as easy as saying, no, we've got backups and, we'll be back in operations tomorrow. It will still unfortunately take companies several weeks to get back to operations. So the measures that John mentioned, that monitoring 24/7, absolutely critical. Sounds like John's moving in that direction. Multi-factor authentication that I saw on the list, absolutely critical. Minimizing those individuals that have access to those privileged accounts, again, absolutely critical. I'm not going to say it's easy. It isn't. It never is. But these are absolutely critical measures that do have to be put into place.
Thank you, Art. So John, did you have anything you wanted to add to that, or should we roll into the Q&A?
We can roll into the Q&A. I'd be happy to, because one of the things I didn't cover, I see one of the questions is how much did this incident cost? So if you're okay, I'd be willing to just jump right into that.
No, sure, definitely. That's going to be the first question. Yep.
Yeah, so attributing the exact cost, we're working on that as an organization, but let me explain what some of the challenges. So this, you have to remember, all of this happened at the same time as COVID. And if you guys remember what happened across the industry with COVID, we started not doing procedures in the hospital. People were staying home, right? So there was this massive dip in healthcare that caused just a decrease in revenue and operations within the organization. So we had that going on at the same time. So it was one on top of the other, but we're guesstimating right now between 5 and 10 million. The biggest hit that we've seen is what I did mention is the delay in revenue. So we have probably 10 to 20 million of revenue that we hope to recover. Although insurance is, you have to have timely, with CMS, you have to have timely filing and those kind of things. So hopefully we can recover some of that, as like I said, we're really close to having some of those areas able to come online. But if we had to, if I had to give you a number, it would be probably somewhere in that's pretty broad, but it'd be somewhere in that range.
Yeah, John, and I would say that even with the smaller organizations that we see, say a couple dozen doctors and nurses and staff, you're up into the hundreds of thousands if they're looking to recover. Right now, some of it is picked up by cyber insurance if you happen to have cyber insurance. If you don't, those are costs that that heavily impact an organization. I've seen costs go into the millions of dollars, and not including ransomware. So the largest ransomware amount we've paid has been $5 million. And when I say we're helping an organization recover in the healthcare, we've seen demands up to $15 million. We're able to talk him down to something a little bit, quote unquote, more reasonable. But unfortunately, the costs are pretty extensive. About a year or two ago, a company that provided billing services to the healthcare sector actually went out of business because of the extent of the attack against their infrastructure. They lost customers, and so there's all these indirect costs that that you have to take into account that companies do suffer.
Yeah, and the other side to that is, there's a cost aspect. I give some examples of the clinical side, but think of this: when our medical oncology, radiation oncology systems down. Again, cancer doesn't wait. Our patients could no longer receive that treatment here. And now they have to drive 72 miles. That's why I started this slide presentation making that point, right? So when you're a sole provider in a community, that's why we had to actually put in a brand new imaging. We needed to provide imaging services and not have to have someone drive 140 miles north to go get imaging services. So along with that financial side, there's the real impact to humans, to your neighbors, to people in your community when this happens. So these attacks in healthcare are problematic. The extortion, their crime, they're wrong because it affects my neighbor. It affects the people in our communities, and it's a real problem. And again, the investment now as an organization, we've taken the financial hit because of COVID. We're trying to just right size. Our organization ended up going through layoffs. So that's something I didn't share. We ended up having layoffs right before this, so we had fewer resources. It made that much more difficult for nursing, providing care. So it has all those domino effects. And then in transparency, I will also share with you, as part of those cuts, Skylakes, when we were going through the brutal process of trying to figure out how do we shrink our budgets, how do we decrease costs and expenses, Skylakes actually had an MDR solution in place that we had terminated that contract 2 months before. And we were hit. And that's, I mean, you know, that little cost in comparison to what we experienced. So this is the challenge now is, I think for any business or any industry that has, where your data has value, and let's face it, data has value, then the need to invest in legacy systems to get them off those old operating systems that have us vulnerable, right? Investing in newer technologies that even around some of the, you mentioned earlier, Art, like, our pumps in the hospital, those kind of, all those biomedical devices, that's kind of the cost of doing business now, because we live in this world where we have to do everything we can to protect the data and then mitigate the outcome from the attack.
And I would say also that I think it's natural for organizations to look at cost as being direct cost to the bottom line. What I would encourage organizations to do is think also in terms of damages. If you're looking at potential prosecution, if you're looking at cyber insurance, they may at some point need to know what was the total damages to your organization by this incident. And what I mean by that also is, it's not just your bottom line, but for instance, an organization I was with in the past provided information to downstream companies who use that information to provide services. So in theory, the incident that occurred to my organization impacted the ability of those organizations downstream to do their business. And so that was calculated as part of the damage also. And when it comes to prosecution, oftentimes the more robust the damages, the more likely it is that it might get the attention of a prosecutor who may want to take that on for prosecution. So from that perspective, and also cyber insurance may want to know also what was the totality of the damage versus just the pure cost of the organization. And I bring that up now because that takes preparation. You need to be ready to understand what are damages and to be tallying those as you go along, because it's very difficult to wait till towards the end to retroactively try to figure out what those damages are. That'll take a big lift. So good discussion on that. But
I would also, as I see, this continue to increase, right? And healthcare is not a sector that, again, cannot be down, right? It is a sector that is absolutely critical to the functioning of society. And as I see these losses that this sector is suffering, and again, just because we see so many of these matters, I'm of the opinion that the government maybe should be stepping in to provide some kind of relief to this sector that are suffering these losses, right? When you look at healthcare, the profit margins are very, very small, right? And as you're looking at the amounts of monies that are being spent to shore up defenses that instead of me buying a new MRI machine or other critical equipment, I now have to buy these firewalls, or I have to buy these other applications to protect me against these threat actors that, again, as I mentioned, they're mostly organized crime that are conducting this activity. And the fact that this industry, the hospitals cannot go down, I would advocate that that government has a responsibility to make sure that this particular sector has some relief.
I would agree with you on the motivation. Definitely, it all comes, in my opinion, to the information. The information is valuable for resale, but more so, the organization can't operate and can't provide the community service without that information. So we could keep on this one topic for probably the next couple hours and have a really good conversation, but we do have 4 other questions that have been upvoted in the Q&A window there. And just so everybody knows, you can go in the Q&A window, you can vote for these, and then the ones that get the most votes get upvoted to the top. So what we'll try to do here in our remaining about 10 minutes is see if we can't get through these other 4 questions, at least that have been upvoted. So the second question is, would a different email system that detonates the clicked link before allowing the user to go to the site have caught this?
So it's possible. We use Exchange. It's possible, but what I'll say is the bad actors are getting, from what I study in the industry, they're now using AI and using technologies to up their game, to get inside, sit, watch, stay dormant. I mean, when you look at the SolarWinds breach, they were inside systems for months, right? Undetected, learning. So again, this is where I think in the end, it's not the technology, and it's going to be, it's people that really have to be your first line of defense. Because we've since then we use Cisco's Ironport. We've upped that. We've changed configuration on our system, Stealth Watch, Umbrella, a number of these different tools that we now have an effect in a different way than we had before. They're going to help, but I'll tell you, we still see stuff slip through. So there's always the risk there.
Art?
Yeah, it's everything's a maybe, right? As I mentioned, the particular healthcare customer that had been hit 3 times by 3 different groups, and last group knew immediately to turn off the endpoint detection response tools that were in the environment. Again, they're learning. I'm a big advocate and fan of that defense in depth concept, where you've got that layered defense, and if they get through one line, you've got additional lines. But again, they're expensive. To John's point, the weakest link is the human being. But these groups, again, are always learning. You all may be aware of this latest attack against the Exchange infrastructure. There's 4 zero-day exploits being used on that. So these are exploits that have never been seen. And so, you can be doing everything the right way. And in this matter with Exchange, they're going to get in because they've got these exploits that have never been seen. There's no signatures. So it's always for organizations, a catch-up game, right? Because the threat actors are very well funded. They've got all the time in the world. And as John mentioned, that persistence, when they're inside an infrastructure, they in many ways know the infrastructure much better than the organizations. I worked with an organization that had their infrastructure, and they were running a PCI infrastructure. And when I was talking to the CTO about the code we had found it was scraping the credit card records. The CTO says it's not possible. I built this infrastructure, and literally we had to show him how the attacker had engineered a very unique piece of code to run in that environment over many months, right? And I mean, he almost fell out of his chair because he did not believe it was possible. So again, it just shows to the, unfortunately, I hate to use this word, the brilliance of some of these threat actor groups to be able to overcome some of these defenses. Now we can't give up, right? So it's that, defense in depth, making sure employees are trained. That continual training is absolutely critical.
100%. So really quick, a 0-day is bad code or a program that is so new that there haven't been antivirus signatures, or really the community hasn't seen it yet. So it's just brand new. And so it is a lot more dangerous than those that have been out for weeks or months. And so they're known, the programs can see them, block them, whatever the case is. The second thing is, when we talk about detonating emails, simply that means that before the user can open it, the program opens it, the system opens it. And when it opens it, it looks at what is the code inside of it. What does it reach out to? Does it reach out to bad sites, whatever else? So that's what happens when it detonates. It detonates it, and then it sees nothing bad, and then it carries on to let the user open it. Otherwise, it'll block it, trap it, and not let the user open it because it's doing bad things. So John, a couple questions for you here, and please answer them if you feel comfortable. Some of them might be showing a little bit more of your hand than you're comfortable showing. Question number 3, are you now blocking access to unauthorized cloud storage sites, such as Google Docs?
Yes, I'll just be quick. Yes, we are. We're just to give you guys an example. We had, we also have we're a teaching hospital as well. It's unique. Sky Lake's most community hospitals are not also teaching hospitals. We are. We had a physician that built out an elaborate set of tools with Google Docs for scheduling. We shut it down and went to something different. It was painful. He wasn't happy, but we were able to provide. The answer is not no. The answer is, hey, let's help you. Let's help you innovate and find another solution that maintains the integrity of our organization.
Art, I know you can probably talk for an hour about this. What are your thoughts around?
Yeah, no, again, to John's point, right? So you can't shut the business down, right? So it's what are the other solutions that we can use as organizations in lieu of maybe a application that is a little bit more risky? So I'm a big fan of risk assessments because it helps us understand what the risk in an organization is. So, if you're bringing a new application in, and especially when that's being developed in-house, you've got a process so that's fed through a security review to make sure you're not introducing risk into the organization. So, that to me is absolutely critical. Any new, either developed in-house or COTS, commercial off-the-shelf product that is brought into an environment, run it through a risk assessment process. Make sure you're not introducing risk into the organization.
Good points. I've said risk assessment so many times in past webinars. I promised I wasn't going to say it this time, so thank you, Art.
Yeah.
Number 4, how did you determine your backups weren't affected? How far back was your last clean backup?
Yeah, so again, what we did on Cisco Talos recommendation, we had those 3 environments. So we would always restore to an area, and then we would do, once we restored, from the backup. Sorry about that. Once we restored from the backup, we did full scan. So we had not only the tools that Cisco was running internally, but the third-party vendor of Kivu Consulting, they had their own tool as well called SentinelOne that they put on our system. So before that, when that backup was brought back online, it was in that staging area, validated to be clean before it was moved into protection. So for us, the issue wasn't so much how far, because we had backups to like the 25th. So when we restored email, when we restored our clinical systems, we literally had backups to right before we went down. We were very, very, like Art mentioned earlier, we were extremely fortunate. Now, I will say this last week, we just discovered a couple forgotten servers that are physical devices that contain some additional images that they're totally encrypted. And so we're going to lose that information. And so now, honestly, we're at a point where we have to grapple with How clinically important is this data? And now do we go back and, because we've never entertained talking, I'll answer this question too real quick, Ron, because it's been several of them in there about ransom. Why didn't you pay the ransom? Let's talk about that. So first of all, our stance is, I just say in the words of our CEO, we don't negotiate with criminals, period. So our stance from the start was, we don't want to pay this. We interacted with the FBI. The FBI supported us in that decision. We can't, to whatever extent possible, let's not fund these bad actors, these nation states. There are circumstances where you do have to pay. So we really haven't entertained it. And because we were able to fortunately restore the majority of our systems, as painful as it's been, but with as good as technology as we've used to do that, we never entertained the notion to pay the ransom. Now I'll tell you, now that we found some additional data that is fully encrypted that we can't get to, we're going to have to banter that decision. But my guess is that we're probably not going to land on the side of paying a ransom for that just subset of data.
All right, let's go into a lightning round here. I think we can answer several of these maybe with one or two words each. So John, who or what position led the incident response team?
So at Sky Lakes, my position, I'm the Director of Information Services. I led the team here at Sky Lakes and communicated out with senior management as well as across the hospital, and led our daily huddles, and had my management team report up to me for that process.
Okay. Art, who or what position have you seen lead incident response teams most effectively? Let's put it that way.
Yeah, so it's gonna depend on the size of the organization, right? So if an organization is of a certain size and has a CISO and a dedicated capability to respond to incidents, and they practice it on a regular basis, that's going to be the most effective team, right? And in a team, when I say dedicated incident response team, I'm not talking just security folks. I'm talking a multifunctional team of IT, security, legal, marketing, outside counsel, and maybe the firm that you would use in the event of an incident that you needed to bring in, that you have on retainer. So I see those firms that have that capability and they practice it on a regular basis. There was a report recently released that said that companies that practice incident response on a regular basis are able to cut their response to an incident by more than half, and the dollar savings are pretty substantial because they've been practicing, right? And I would say, like anything else we do in life, if you practice what potentially is going to happen, you're in a much better position because you're not scrambling around when an incident actually occurs.
Good answer. So we'll do one final question here, which should be a pretty quick one. Then I'll give each of you a minute or two for final comments. What email platform was used at Sky Lakes at the time of the compromise? Is it on premises, or in the cloud?
Yeah, so we're using Microsoft Exchange, and I'm not happy to say it's an older version of Exchange, especially with all the stuff happening right now. Art might mention what's going on with the Exchange right now, but yeah, it's on-prem, and we are in the process of actually moving to 365, knowing though that creates a whole nother set of questions and concerns, but we're in the process of that.
So Art, 60 seconds, any final thoughts?
Yeah, so this in talking to the email, if you've got on-prem Exchange, I'd say you want to make sure you patch those systems. We at Palo Alto are inundated right now with customers calling about this particular attack. Again, 4 zero-day exploits. That's very rare. That's almost, you would say, nation state actors. I would say you want to make sure you patch those systems before a threat actor gets access to your environment, because they are deploying through your email Exchange server. They are getting into the infrastructure, and who knows what they're going to do once they're inside. So I would highly recommend to those of you that are running that kind of environment, make sure you are patching those systems ASAP.
John, final thought?
Yeah, one just to answer this question because it's part of the ransomware. So Skylakes has no evidence of any data exfiltration. What we learned from both Kivu and Art, you could elaborate on this, but from both Kivu as well as Talos, it's actually very difficult to determine exfiltration. But that's exactly why we brought in Cisco Talos. We needed a deep bench of people to make, especially in healthcare with EPHI. And what we do to secure the data in healthcare, we were able to, with their work and their tools, determine that we did not, in fact, have any exfiltration, which, again, we're most grateful for because the bad actors use that as another form of ransom and extortion. They can't get you on the encryption keys and they try to get you on the release of data, which is really problematic.
Yeah, John. So yeah, absolutely. Some of the newer ransomware variants out there, not only do they do the encryption, but before they do that, they do data exfiltration. So sometimes you wind up negotiating with a threat actor, not only to get their assurance that they're going to destroy the data, but also you have to negotiate to get the keys to unlock your system. So that's worst case scenario. We see it. That is the most painful attack on an organization when they've taken your data and you're relying on their assurances, right? They'll send you a JPEG showing that they've deleted the data, but you're dealing with criminals, and how sure are you that they're going to actually delete your data?
Well, thank you. And my final parting thoughts is to echoing what we've been saying earlier. It's all about the humans. Information security, cybersecurity is a human problem. Awareness education is huge. It's the humans that are going to spot it, report it. And we keep thinking of the humans as being the weak link, but they're actually our strongest link if we empower them and we educate them. So please keep that in mind. It's not just technology, it's not policy, it's about the people.
Yeah.
So Art, thank you very much for joining us. We know that this is an extremely busy time for you and you took the time out, so we do sincerely appreciate this. John, thank you too. Thank you for sharing. We use the term veteran to mean a certain thing, but I think that you definitely fit the label of a veteran at this point, having survived what you have and led the organization through a successful recovery. So congratulations, and as Art said, kudos to you. At this point, I'd like to bring back Dr. Banyan for an introduction to the Marco Hatfield Center for Cybersecurity's Professional Certificate in Building Cyber Resilience. Briefly, a little bit about Dr. Banyan. Dr. Margaret Banyan, PhD, serves as a senior fellow at the Center for Public Service at Portland State University. She has designed and implemented innovative projects, collaborative research initiatives, and multi-jurisdictional planning efforts, including developing a statewide collaborative plan for cybersecurity and programs that build organizational capacity for public agencies. She has worked with a wide range of local governments, nonprofit organizations, and special districts conducting policy and organizational studies. She has published in Public Administrative Review, Administrative Theory and Praxis, the Encyclopedia of Governance, and has authored several individual and joint book chapters. Over to you, Dr. Banyan.
Thank you. Fantastic presentation. I know that Ron said that he was not going to mention anything about a risk assessment, but I will. Because that's a lot of the focus on our cybersecurity certificate. So what we have coming up is a largely non-technical certificate that is going to work with folks on developing kind of this risk management perspective. So it's really designed for managers and leaders working in small to medium-sized organizations. So just a broad overview about what the certificate will cover is issues such as kind of the major threats out there and how they can be mitigated, how to create and implement a comprehensive risk management program, cost and benefits of various types of security approaches, and then as well as strategies related to privacy, legal and regulatory compliance, social and geopolitical impacts, and then a section on best practices. So best practices for mobile workforces, security metrics, manage electronic evidence, e-crime and e-discovery, and securing information in the cloud. So that's really what the course will deliver. And there's some additional elements here that Ron talked about, and you all really talked a lot about people and the role of people. So we're adding this element about how internal and external collaboration can enhance risk management, as well as dynamics of decision-making in a complex environment, both at sort of the individual and the organizational level. So kind of the outcomes that we expect is that participants will develop a risk assessment plan, and it's really more of a case study approach, so that everybody can kind of get their hands wet or dirty, whatever we want to analogy we would like to use in developing a plan. So the typical work week is going to be working through videos, readings, and assignments. Much of it's online. And these are been developed by cybersecurity experts in the field. And then we have select meeting dates where participants will meet with the course coaches and then guest speakers who are also experts in the cybersecurity field to answer questions about the material, sort of discuss interesting questions, and network with other colleagues that will be in the course. And then at the final conclusion will be kind of a case study to develop that risk assessment and or management plan. So that's the certificate overall. It's a 12-week online in part, but it will have remote meetings at select Fridays. So at this point, I want to start to wrap up our panel here today, and really just thank so much John Gaede and Art Ehuan for your participation today. And a huge thank you to Ron Buchanan for moderating this panel discussion and keeping us all ordered and on time. So, and then finally, we just want to do another shout out for Palo Alto Networks, who's made this available to our attendees free of charge. So a reminder that they're also giving away door prizes to say thank you for attending. And if you've already do so by entering for one of their swag bags, and a reminder, that's the Yeti cup, Nike hat, and more, and a multi-charger. So we've also posted in the chat the link to enter and volunteer to contact your information so that they can tell you if you won. So I think that wraps up our seminar today. Again, thank you so much for joining. It's just wonderful to be able to hear these conversations.